as she mentioned, this is going to be a discussion on how I developed this COVID-19 supply chain dashboard in Squirrel and did it very quickly. Okay, so let's jump right in. This was the interesting challenge that I was presented with. One of our clients came to us and said that they wanted to create this COVID-19 dashboard, and these were the metrics that they wanted to show. So they had 57 metrics that they wanted to show, and there were single value metrics. And because this was right during COVID and all of this was new data, there was absolutely no historical data to go along with this. So there was no possibility of creating charts or anything that a usual dashboard would include. So it was an interesting challenge, and so I'm going to take you through the process, okay? So initially, I was presented with this list of metrics, and it just looked a little bit overwhelming at first. So I examined the data a little bit more and made a rough guess at some groupings for that data. So I could see that there were some metrics grouped around staff and ventilators, which were so important there initially with COVID, and then masks and gowns and gloves and sanitizing stuff, and then some drugs, and some things I didn't even know what they were. For example, ear loops. I had no idea what they were initially. We've all become a lot more familiar with masks and know what an N95 is now, whereas, you know, in March, I didn't know what an N95 was. So that was the first step, was figuring out, okay, is there data that is related that I can group together so that it's logical to see those numbers together? So that was my first step in just getting some grouping in there. And once I knew how many groups I had and how many metrics were within each group, which ones were the big ones, which ones were the small ones, then I made a first attempt at a layout. And this was my first initial planning. So it looks very ugly, and let me explain the reasoning behind that. So I started off with just creating these blocks, and they were just blocks of colors, just so I could get a layout going in here. This is what I was intending to go for, but I first needed to see how things would fit in here based on the groupings that I had done, and run it by my client to see if they were good with this particular layout of the data, since they weren't sure at all what they wanted initially either, except that we knew we wanted to include some icons in there. So we planned some icons from the beginning and started on a layout. So once I kind of figured out how things would start fitting in here, I started adding more components in here. And as I mentioned, since these were, you know, there's no charting in here, so these particular ones are all just labels in here. The values in here, so labels, some icons, some controls, and some drop downs. So they wanted to be able to view this data so that either someone coming in from a facility or a regional vice president or a market president could open this dashboard up and see totals for the hospitals that they were in charge of, and then be able to drill down further to the specific facilities and see what their numbers were. So that was the initial layout. Once we got approval on that, I started fleshing it out a bit more and adding a few more icons in there just for ideas at this point, knowing those would not be the final ones I used, but just to get some ideas and get our ideas flowing for that. So this was the next layout, how far I got, and started just lining things up using the aligning tools within Squirrel to be able to get these values lined up and centered with each other, things like that, and working through that process. And then this was the next part where now that I know where I want things to go, I started connecting it to the data. So the customer had already prepared the information in a web intelligence report. So they were gathering the data in their data warehouse and then using a universe that they quickly developed on top of it to be able to pull it into a Webby report. And then from that Webby report, we used InfoBurst to create this XDC to be able to pull and filter the data very quickly using the drop downs up here. Okay, so that was this step, was getting it connected to the data and changing things and do things change when you make selections up here. So once that step was done, I was ready to go to the next part, and that was, let's make it look pretty. We're ready for the design team. So Infosol is very fortunate to have a design team that can help with the layout and the look and feel. They're extremely talented, and so we put this dashboard as it was in their hands and said, okay, what can you do to help us make this a more effective dashboard so that the right things are showing and that it's not so cluttered that, because as you can see, even with this, okay, we've got these metrics laid out, it's still, your eyes get lost in here pretty fast. So our great design team took this, they asked questions on were there corporate colors that they needed to take into consideration, and in this case the customer was fine with whatever colors we wanted to choose. They said it doesn't really need any branding apart from their logo that they wanted included. So the design team took what I had done and came out with a beautiful new redesign. So this next slide is going to be the first iteration of that redesign. And you can see what such a much cleaner design that they brought. And still, this was not the final version. This was just an iteration in that process. And they asked some questions up here, wanted to know if this was obvious enough for the selector, and the customer was happy with that. And then all of the data came with available and diverted. So how many had been diverted? And the design team rightly thought that the available number was the most important thing to display on there. And the diverted amount could be shown, but with smaller font. And they wanted to make sure that that was okay with the customer. And so we ran that by the customer, and they were good with that. So then we started I started making the changes based on this design to get the dashboard looking much more like this, and we worked through the iterations of that. The lower section here for masks and the drugs over here, these are just a scorecard displaying on here, and so that made it the layout for handling so many of these much easier on the eyes to be able to process that information. All right, so I got started. So this now, we did some more refining of where things were gonna go, moved some of the initial stuff over here, added some background color to the top here, and got some new logos. We gave the initial logos to one of our graphic artists who came up with these great images. But I wanted to point out how the colors of the circle behind them, that just added so much. And the color of the spot coordinates with the color of the little square that they're in. So made it for really easy on the eyes, really easy way to process this information, and made the important numbers prominent. Okay, so it was cool to see this move along and get more beautiful, and we just continued working on it. So that was the first tab of the dashboard, and then they had a second tab, which was this daily stats, which were, so for the facility, how many days were they going to be open this week and next week? What was the plan? How many staff hours were planned? Looking at some financial information as well, and then cases, number of cases, number of cancellations, and how many of those were canceled because of the virus. They wanted to be able to track that. And then their rooms, how many procedure rooms did they have open, and how many OR rooms did they have open? So this was the first, they gave us these additional metrics that they wanted to include on the second tab. And so we started just looking and seeing how much information we had in each group, and then got some input again from the design team to modify the layout here and put them in a very similar layout to the first tab, which helped with consistency as well. So we got some great help with them. And the next one, then we needed more icons for this second tab. Pardon me. And our graphic artist was able to provide some more great icons.
All right.
And this is what that tab ended up doing.
Hey, Roxanne.
Yes.
Sorry, we lost you there for a second.
Uh-oh. How far?
You're back though.
I need to back up a little bit. I'll just go back.
Yes, I would back up to that slide, yes.
Okay. So this was the final redesign of the second tab of the dashboard to track the daily stats. Okay. And that's how it all came together. And then the customer had another idea, which I think was a great idea. Really good use of a dashboard really should drive action, right? So he said, hey, Roxanne, is there a way to hover over the data and have a pop-up that could show the details for the facilities that made up these numbers? So we started another iteration of this, which was adding push buttons that were transparent over each one of these boxes here, so that when you pushed that, a pop-up would open up and show you the facilities that made up those numbers. And I'll show you that in the actual demo of the dashboard in just a moment, okay? So before I open the demo, I just wanted to point out the timeline for this dashboard. So from start to deployment was 14 business days. I started, this was the very first one on April 10th. That was the very first day of starting with it on April 10th. And then it was finished on April 29th. And that's when it was deployed at the customer site in their production environment. So 14 days, 14 business days from the 10th to the 29th. So we were really amazed at how quickly this came together, and we were able to put this very time-sensitive data out there for the hospital administrators to be able to start using right away. And then, as you can see here, maybe, oops, about a month later, they came back and with some good feedback from the dashboard. They really liked it and they wanted to expand it. So there was a phase 2 to the dashboard where they wanted to see data for both their hospitals and their surgery centers. And so we modified the second tab again to have different data for that. So it was well received and well, went over very well at the customer site. Okay, so now I'm gonna switch to dashboard. All right, can you see my squirrel dashboard now?
Yes, we can see it.
Okay. All right, I'm gonna go into preview real quick just so you can see. So we also, subsequent to this, created a generic version of this dashboard. So this is not customer data. And you'll notice the drop downs are different. We don't have the market president, regional vice president, and I just created a state filter and a facility filter. So this is how it looks, and a user could filter the data down. They look at Florida data, and these would be totals for that particular state. And then they could narrow down to a particular facility within that state. So that's basically how it worked for the customer as well. And these are the pop-ups that I mentioned. So if you hover over and wanted to see, oh, this Florida only has 20 surgical gowns, or I'm not sure whether it's 20 boxes or 20 actual gowns in the whole state. So they could use this, click on the pop-up, and it would open this window and show, all of those are at one particular hospital, and the others are showing 0. So maybe we could go to a different state. Georgia doesn't have any either, but Nebraska has 200 of them. And we can see they're all at one particular hospital again. So we could distribute some of those to other facilities and have them diverted to other locations until more supplies became available. So that was the idea behind the use of these, that they could pop up and see the distribution of these. You could see one particular hospital, again, had quite a bit more than the others, but they could then use this information to move their supply chain around and distribute it, especially during these unprecedented times and where supplies were not as easily available as they had been before. So this was one of the tools that they used to be able to weather this storm, and it turned out to be very, very useful for them. So now I'm going to go back to the design mode and just give you a quick preview under the covers. This is the daily stats. I'm going to hide that for now. So what I did is create groupings of this, of the data, so that I could move the whole group around together. And then within the group, tried to label things so that I could find out, if something wasn't aligned correctly or not wrapping correctly or something, I could quickly find it. And then within here, I could say select all of the numbers here and use the aligning tools to align them and make sure that they were all lined up, same size, things like that, and distributed evenly. So Squirrel makes it easy to be able to do that as well, to distribute horizontally or vertically, and then size, make them the same height, make them the same width. So those were very handy in this particular dashboard with so many labels. So grouping them together, that also became extremely important. You can imagine with 57 metrics and all their labels, so that's already over 100, plus the icons. So we're talking about, a fair number of components, but being able to group them together here and name those groups in a logical way and then hide them when you need to work on another area made it real easy to work in here and move quickly. So that was extremely helpful. And let's see. So as I mentioned, the idea for the pop-up window came later in the process. So you'll notice I have a separate group for the selectors. So this is the first row selectors, which is covering this whole first row. And these are just push buttons over each one of these. And the transparency is taken down to 0. So they do their job, but you don't see the any color or anything interfering with the dashboard. However, notice that we have the hover over state working, so that when you hover over that, you would get an indication that there's something on there to click. So that worked out great. And then in the lower part, for the scorecards, we were just able to use the native selectability of a scorecard to be able to select a particular row here to make that selection and see what was available for that, for the masks or for the drugs over there on the right. So it came together very nicely. This dashboard also won an award at the last IBIS conference, and it was really cool to see the way this customer brought things together very quickly, made quick actions to be able to gather the data and input the data. One thing I didn't mention was, let me come up here. I'll go into preview. They included some information up here at the top. So if you select a particular facility, notice it would say 2 clinics not reported, or, and this data isn't really following through, but on the actual dashboard, it would change and show for each facility or each grouping how many of their facilities had not reported. So they could know, okay, it looks like I need to talk to some of my facilities to make sure that they're entering this information so that the dashboard can be more accurate. And then also within that, you could select a facility and see when was that information last updated. So in this case, notice, and I don't remember what the date this data was taken on, but it was last updated on 4/22. This particular one had updated on 4/21, but this one down here, Olympus Medical, had not updated since the 8th. So that data, you could see right away that this was, it was at least 2 weeks old data on there. So maybe a call needed to be made to the admin at this location to be able to follow up and make sure that data was being inputted on a regular basis. So it made it a really high functioning dashboard within a really short period of time. So that's what I had to cover. Were there any questions?
Yes, we had a question come in. How was the lack of reporting from a particular facility identified?
You could click to view the details. So let me see if that is working. So for those two facilities, it's not working in this generic version. I still have to get that part working, but the way it worked in the production was it would list those two facilities right there and show their IDs. The next logical step would be to include the admin's name for that facility and perhaps a phone number so you can quickly follow up with them. But that was how that's handled. That's a good question. But yes, they thought of that as well, to identify those facilities that were not cooperating.